We forget it sometimes, but as adults we have quite a lot of strength. For this reason, playing with children can be tricky. Their fragile anatomy can be strained if you're not careful. In this video, we'll explain how carrying a child by the arms can be dangerous. It's a classic scene, to say the least. A child walks with his parents. And to have fun with him, they can lift him by the arms and then put him down. While most find it rather adorable, it is important to know that it can be dangerous for the child. Whether for humans or for the animal world, an individual goes through a phase of development before reaching adulthood. For humans, this period, which is called among other things childhood, lasts much longer than in the animal kingdom. Thus, it should be noted that the body of a young child is at least quite fragile compared to that of an adult. More specifically, bones and ligaments are still developing. To this end, orthopedic surgeon Amir Khan of Dr. Fee said that the pulling force exerted on the child's upper limb can in some cases cause joint injuries. For his part, Adam Pandit, consultant shoulder and elbow surgeon at Spire Thames Valley in Slough, assures that this type of injury is rare but that caution is in order when parents play with their children, especially if the latter are of an age when their joints are still forming. Most adults are aware of how fragile children's bodies are. So when playing with a little one, adults exercise legitimate caution so as not to injure the latter. However, this should not be a reason to avoid playing altogether. Play is of the utmost importance for a child's development. It teaches them to push the limits of their bodies and develop socially. It is not uncommon to see children being carried by the arms. We must admit that they love it and can ask for more with a lot of enthusiasm. However, it could be dangerous for the health of a child. So parents can hurt their child without wanting to. The cause is also quite simple. It is once again the fault of an anatomy that is too fragile. The child's bones and ligaments are still developing. Thus carrying a child by the arms can cause elbow subluxation. When the arm is pulled sharply too hard, the head of the radius, which is the forearm bone, may protrude slightly from its ligament. This is called an elbow subluxation. This injury, which typically occurs in children between the ages of 3 and 5, becomes increasingly rare from the age of 6, as the bones and ligaments become strong enough to take the pressure. It is characterized by a sharp pain that can manifest anywhere in the length of the arm, wrist and even the elbow. If a child can no longer bend the elbow, it is likely that he has an elbow subluxation, so it is essential to see a doctor to check the condition of your child's arm. Most often, elbow subluxation occurs when carrying a child by the arms. Avoiding this practice is therefore a sure way to minimize the risk of developing this injury. In addition, it should be noted that this can also happen if you pull your child by the arms, so be careful when holding your child's hand. Try not to go faster than him. If you feel like carrying your child, know that it is much more prudent to lift him by taking him under the arms and avoid the hands or even the wrists.